Hello everyone, today we are going to talk about sexually transmitted diseases. Infection can be transmitted in several ways, whether through air droplets or contaminated food in the mouth, as well as through contaminated blood. But do you know that there are diseases transmitted through sexual intercourses? Well, we will talk about STDs in this video. After watching this video, you'll be able to distinguish what STDs are, what are their symptoms, and how they can be diagnosed and treated. Our role today is to answer most of the questions regarding STDs. Today we have Dr. Xin, who is a leading doctor at Stantop Clinic. He is going to discuss with us everything about STDs from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Hello, Dr. Xin, how are you?
Hi.
안녕하세요.
So can you introduce yourself to our audience?
네,
Hi.
안녕하세요.
I am Shin Chiang-jae, a urologist.
Nice to meet you.
Sure.
So for our first question, what are sexual transmitted diseases or we know as STD?
STD or sexually transmitted diseases are, as it says, diseases transmitted through sexual activities. Sexually transmitted diseases such as urethritis, UTI, herpes, HPV, AIDS, and even skin illnesses are within the scope of STDs. Sexual activities are not limited to a man and woman's genitals, but also oral and anal. Also, transmission can happen between men as well as between women in homosexual relationships.
So what is the diagnosis and treatment for STD?
For STD for men, if there is discomfort during urination, if there is a pus coming out of the urethra, or if there is a presence of blisters in the genital area, also pain and swelling, etc., could be a variety of symptoms possible. However, in reality, many could be asymptomatic or could have very mild symptoms only. So we do not rely solely on symptoms. We use a simple exam. For a urine test, we try to see if there is a presence of bacteria or a virus. With a blood test, we can see if there is herpes, syphilis, and AIDS. Through a skin test, we can see if HPV or other STDs are present. In terms of treatment, most STDs are curable, thankfully. While the treatment depends on the disease and condition, we can use oral medicine or injections. However, illnesses such as AIDS, HPV, and herpes, which are all due to viruses, a cure is difficult. However, if discovered early and good care is taken, we can limit the progression greatly and limit the transmission to others significantly.
So for the prevention of STD, what are the prevention of it?
While everyone likely knows, the best prevention tool is a condom. Condoms prevent bodily fluid-based transmissions. Any bodily fluids, including secretion and blood, can be lowered greatly through the use of condoms. But since condoms cannot cover all the genital areas, for example, the skin, we cannot prevent all transmissions. Even given that, I do recommend using condoms. I also recommend getting regular checkups. Like I said early on, asymptomatic infections are very common. Many do not even know they have a disease. They should just get regular exams, and if infected, they should be treated at the hospital. This would be a very effective prevention action. Lastly, vaccinating against hepatitis or HPV can also be a good preventative method.
백신을 통해서 면역력을 갖춰주는 것도 좋은 예방법이 될 수가 있겠습니다.
So is it a must for men to have HPV vaccine as well?
I will give the answer first. Yes, it is true. Even for men, HPV vaccines can help with prevention. So far, there is no medicine that can cure HPV. HPV vaccine is safe and can prevent various conditions such as blisters, as well as some cancers. So it is now also important for men to get the HPV vaccine. Even if one had HPV before or currently has it, taking the vaccine can lower the risks of various symptoms or even cancer. So it is also important to the partner. If the partner is a woman, it can lower various risks, including cancer.
여성 파트너를 갖고 계신 분들이라면은 자궁경부암 같은 발생도 상당히 낮출 수가 있겠습니다.
So what are the symptoms of HPV and how does it affect our life if we don't treat it at all?
네. 많은 사람들이
Many are actually infected with HPV. When we look at the USA data, about 80% can get infected with HPV. However, the symptoms are usually not clear. About 90% will have their HPV disappeared within 2 years. If the virus is not gone from the body, there can be genital warts in the anus, vagina, etc. The warts can also travel through the lymphatic system to the neck area. If these warts are not treated, it can progress into cancer. In men, penile cancer, rectal cancer can result. In women, HPV can cause uterine cancer. These cancers are most commonly as a result of HPV presence. For women, since it is hard to self-exam the inside of the genitals, so it is important to get regular exams. For men, if there is a new skin tag, dot, or wart, it is recommended to visit a urologist to get a checkup. If needed, surgical removal is the best route.
Okay, for our last question, is it true that men need to circumcise to prevent STDs?
Yes, to some degree. Circumcision lowers the risk of HPV or herpes by almost 30% according to some studies. This is why many recommend circumcision. While not all would need the procedure, there are those with excessively long foreskin or very narrow aperture which predisposes them to wounds during sex. So we recommend circumcision for sure. Also, it is easy to get infections. If these issues are of concern to you, it is best to visit a urologist to discuss options.
Okay, that's it for today. Thank you so much, Dr. Shin.
네,
Thank you.
감사합니다.
So today we learned many things about STDs, and the doctors explain everything in details related to this type of infection, such as symptoms and how can be diagnosed and treated. Thank you for joining us once again today at Clarksville TV. If you have any questions or comments, please leave them below and we will respond to you as soon as possible.